How did the doctor miss it? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about that question. How did the doctors miss it? What we have here is a mother who had a child who was complaining of fatigue, diarrhea, abdominal pain. The child just was not doing well at all. And because of all of this, mom got worried, like any mother would. And she decided that we need to take our child to the emergency room. So off to the emergency room they go. And when they get to the emergency room, the doctors take a history, they find out about the complaints, but they don't really do a physical examination of the child. They don't run any tests. What they conclude is that the child is more than likely suffering from a stomach virus. And as a result of this, they tell the mother to make sure to give the child plenty of fluids and liquids, keep the child off their feet, and to miss some days of school so the child can get better with everything. Mom finds out about everything and says, okay. So they take the child home. They're following all of the directions of the medical professionals. And we're going to fast forward into time about 4 or 5 days, and the child is just still not getting better. So mom then calls the child's doctor, a pediatrician, and lets the doctor know what's going on. Doctor takes all the information over the phone, does not have the child come in, and does not do any type of examination or anything on the child, but follows up with the same diagnosis that the emergency room. Doctor pretty much says that more than likely, ma'am, your child is suffering from the stomach bug. So again, plenty of fluids, keep the child home from school for a couple of days, keep the child off their feet, and everything should get better. Well, we're going more in time. Now we're talking about a couple of weeks in time now, some more days in time, and the child has not gotten better. I mean, if anything, the mom is noticing that her child is getting worse, way worse. So off to the emergency room they go again. This time the child again reporting diarrhea, abdominal pain, fatigue, vomiting, nausea. All of these things are happening. And this time the hospital notices, the emergency room notices that there is blood in the stool. And they begin to now do a more aggressive evaluation and examination of the child. Well, long story short, when they run the test, abdominal tests and other types of tests, they find that the child's appendix has been ruptured, and that this child, and this delay in this diagnosis, has been dealing with this for a while now. And as a result of this, we have some massive infections going on with the child. Tubes had to be used, and a surgery had to be done to work on the lower digestive area because infection had set in. So why have I taken the time today to talk with you about this? How did the doctors miss it? Because I'm trying to give you insight into this process. Generally, when a patient presents, doctors use a thing called a differential diagnosis. That's the tool that they use to help them get to the right diagnosis. And what this differential diagnosis is that the doctor will take the complaints, and either in their mind or on paper, they will list out the possible diagnosis that the patient could be dealing with. And they have to note the most serious first, because that's common sense. If it's the more serious it is, the more injury that the patient can suffer, or even possibly death. So once they have this diagnosis, what they think it is they have to then do examination. They have to run tests to either confirm or rule out the diagnosis. So again, I'm trying to help you understand this process. I'm giving you insight into some of the issues and some of the areas that your Maryland medical malpractice attorney is going to be looking at when we are talking about a possible misdiagnosis when we're dealing with a Maryland medical malpractice case. If you have more questions about your situation, maybe you have a diagnosis or you've suffered an injury due to a misdiagnosis or a delay in a diagnosis or a treatment or something like that, and now you have questions about what's going on in your situation. If you have these types of questions, this is what I invite you to do. And remember, it costs you absolutely nothing to take this next action. And what is that action, Marcus? to pick up the phone and give me a call. I can be reached at 301-850-4832. Or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury, wrongful death questions just like yours all the time. And I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.